Welcome to This Explainer. Today, we are diving into a year that literally rewired the trajectory of modern history, the 2020 COVID-19 pandemic in the United States. We're going to trace the rapid escalation of the virus, the early public health measures that brought everyday life to a screeching halt, and the profound, lingering societal shifts that followed. So let's trace exactly how this unprecedented crisis unfolded. But before we get into the timelines and the policies, we absolutely must ground our analysis in a staggering reality. Over 975,000. That is the number of American lives ultimately lost to this virus. It's a sobering statistic, and it really forces us to examine exactly how a localized outbreak thousands of miles away so quickly infiltrated our communities, completely overwhelmed our systems, and changed the way we all live.
Part 1. The First Sparks. This covers December 2019 through February 2020.
You know, what's really fascinating about this early spread is the gap between when the virus actually arrived and when we officially detected it. Retrospective data from American Red Cross blood samples suggests the virus was already present in the U.S. prior to January 19th. But the official snowballing began on January 20th. That's when the CDC reported the first laboratory-confirmed case and a man returning to Washington state from Wuhan, China. And just 10 days later, on January 30th, the U.S. confirmed its first recorded instance of person-to-person spread. The spark had officially caught.
Zooming in on the human level for a second, we reach a really critical turning point in our understanding of that early spread. The tragic death of 57-year-old Patricia Dowd in California on February 6th sent absolute shockwaves to the public health community later that spring when autopsies confirmed she died of COVID-19. Why was this such a big deal? Because she had absolutely no known travel history to affected areas. This signaled that community transmission was already happening, completely undetected, right here at home.
And to make matters worse, compounding this early, unseen spread was a severely flawed initial testing rollout. The CDC actually developed a test really quickly, by January 20th. However, a critical manufacturing defect, specifically in the third probe of the test kits, gave inconclusive results. Because of this, state public health labs just couldn't run their own tests. They were forced to send all their samples to the CDC headquarters in Atlanta, which created a massive bottleneck. By February 8th, a lab in Manhattan even reported that the CDC tests were producing untrustworthy results. This failure to test early essentially blinded the U.S. to the true scope of the spreading virus.
Which brings us to February 25th and a frankly haunting warning from the CDC's Dr. Nancy Messonnier. She plainly stated that the disruption to everyday life may be severe, warning of school closings and workplace shutdowns. Now, at the time, things still felt relatively normal for most Americans. But looking back, this quote served as an ominous foreshadowing for the absolute halt of normalcy that was just around the corner.
Part 2. The System Overwhelmed. This is March 2020.
Think back to mid-March. In just one frantic week, the whole system was pushed to the brink. On March 13th, the Trump administration declared a nationwide emergency. The very next day, the CDC issued a no-sail order for all cruise ships. By March 15th, states began implementing severe shutdowns, including the massive New York City public school system sending 1.1 million students home. And by March 19th, California Governor Gavin Newsom issued a sweeping, unprecedented statewide stay-at-home order. In mere days, the vibrant American landscape just went quiet. So, with the economy in an absolute freefall caused by these rapid nationwide shutdowns, the Trump administration signed the massive CARES Act into law on March 27th. This injected direct relief right into a frozen economy, sending $1,200 checks to adults, expanding unemployment benefits, and throwing a much-needed lifeline to small businesses and hospitals. It was essentially an emergency tourniquet for a desperately wounded economy.
Part 3. The Great Shutdown, Spring 2020.
Now, we usually assume government mandates drove all these shutdowns, right? Well, actually, multiple university studies, including one from the University of Chicago, found something really surprising. They found that massive drops in consumer traffic, nearly 90% of the decline, in fact, were driven voluntarily by public fear of the virus itself. People saw the news, they understood the risk, and they chose to stay home long before mandatory lethal restrictions were ever imposed. The stay-at-home orders only increased staying at home by an additional 5 to 10%.
Zooming out to the broader economic fallout, the numbers are just staggering. By May 9th, the U.S. unemployment rate hit 14.7%. That was the highest rate since the Great Depression. With over 20 million people suddenly out of work, industries like hospitality, leisure, and healthcare took massive hits, and this disproportionately affected essential workers and those with lower incomes.
Of course, all this immense economic pressure sparked early and intense political friction over reopening. On April 16th, the White House released gating benchmarks. These were guidelines states should meet before they reopen. Yet, just over a week later, states like Georgia, Alaska, and Oklahoma began to partially reopen despite heavy concerns from health experts that it was way too early. Adding to the friction, in early May, it was widely reported that detailed CDC guidance documents on how to safely reopen the country were blocked by top White House officials. The balance between public health and economic survival became a really fierce, deeply polarizing debate.
Part 4. The Human Toll, from mid to late 2020. Beyond the economy and the politics, there was a severe loss of control felt across the country, as highlighted by data from a Brookings Institution survey. Notice how it disproportionately impacted certain demographics. 30% of young adults and significant percentages of women across different racial backgrounds reported feeling they had less control over their lives. These were the groups often forced to juggle a sudden lack of childcare, shifts to essential work, economic instability, and acute social isolation, all at exactly the same time.
The severity of this stress really can't be overstated. A deeply concerning CDC survey in August revealed a staggering mental health crisis. 41% of respondents reported struggling with their mental health. 11% had seriously considered suicide. And most alarmingly, among unpaid caregivers, the people looking after sick, elderly, or disabled loved ones, a shocking 31% reported considering suicide. The psychological infrastructure of the country was buckling under the weight of the pandemic.
So the crucial takeaway here is how devastatingly broad the human toll was. By October of 2020, food insecurity in the United States skyrocketed to reach 52 million people. That is an increase of 17 million more people struggling to find their next meal compared to pre-pandemic numbers. This crisis touched absolutely every single facet of survival.
Part 5. The Long Road Ahead.
As we moved into the autumn months, it was just this dizzying mix of tragedy and triumph. On September 22nd, the U.S. death toll surpassed a grim 200,000. By November 4th, the country reported an astonishing 100,000 new cases in a single 24-hour period. But right alongside those dark milestones, we saw critical medical advancements. Johnson & Johnson began Phase 3 trials for a single-shot vaccine. And in November, the FDA issued emergency use authorizations for innovative antibody treatments. Science was literally racing against the clock.
Yet, as the virus surged into the winter, the risks remained highly unequal. A major study published in the journal Nature in November showed that most cases originated in indoor gathering spaces like restaurants and grocery stores. But crucially, it found that these everyday activities in densely populated lower-income areas posed about double the COVID-19 risk compared to higher-income neighborhoods. Many residents in these areas were essential workers who just couldn't log into a Zoom call from the safety of their living rooms.
Which brings us to a final thought. After chronicling all these rapid changes, the massive loss of life, the economic freefall, and the deep, disproportionate human toll, we really have to ask ourselves, how will the profound societal shifts and the lingering psychological scars forged in 2020 continue to reshape our resilience as a society? Because these events didn't just happen in the past. They are the foundation of the world we are navigating today. Thank you so much for joining me on this explainer, and I encourage you to keep questioning how these historical moments shape our future.